Dr. Melissa BODUCH serves as a lead learning specialist and academic advisor at the Center for Student Success at Beacon College in Leesburg, Florida. BODUCH specializes in providing academic support, identifying and implementing research-based interventions, and facilitating self-advocacy. Prior to Beacon, she logged 19 years as a middle and high school special education teacher. Dr. Wanda M. Hadley is an associate professor of higher education leadership, educational leadership, research and technology at Western Michigan University. She received the 2017 American College Personnel Association's Disability Leadership Award for her research and scholarship about students with learning disabilities. Dr. Holly Schiff is a licensed clinical psychologist practicing in Connecticut, New York, and Rhode Island, and works at South County Psychiatry. She specializes in treating children, adolescents, and young adults, and also conducts neuropsychological evaluations and psychoeducational assessments while working closely with schools and universities. And we're going to actually start our conversation with Dr. Schiff. Let's clarify from the start, are specific learning disabilities the same thing as mental illness?
Yeah, so I'm so glad that you asked that because, this is such a common misconception. So specific learning disorders are not synonymous with mental illness, and you can't use the terms interchangeably. However, mental illness and learning disorders often do co-occur, and they share lots of the same features. But learning disorders are neurologically based, and so they affect an individual's ability to process information. So thereby, it's going to have an impact on how they learn, understand, communicate, and remember information. So learning disorders occur as a product of the brain kind of deviating operationally from the norm. So there's some faulty wiring in specific areas of the brain. So learning disorders can't be cured since they're neurologically based, but we can minimize and sometimes even eliminate the impact if appropriate interventions and supports are provided early on. So these kids have the mental machinery to do well and the intellectual capacity to perform, but because of how their brains receive and process information, they usually struggle to accomplish tasks, and that's why you see them have more trouble in school and life in general.
Thank you. Well, Dr. BODUCH, if mental illness and learning disabilities aren't synonymous, why does research suggest that children with learning disabilities have higher rates of mental illness?
Oh, thanks for asking. That's a great question, because when you do think about our students and as they're functioning, life is hard, right? They're already having some struggles that are in place for them. Life is hard, learning is hard, communication is hard, socialization is hard. That's life, right? Life in general is hard. This takes a toll on anyone, let alone someone who has a learning disability. This makes it even more difficult for them. You've got academic stress. They have trouble learning, so because of all of those impacts, this will hinder their physical and their mental health. When you think about it, these are also the kiddos who, they get the upset stomach because, oh my gosh, going to school is hard for them. So that plays a part into it. They start becoming much more aware that they're different than their peers. And as they start getting further in their school years, that gap becomes bigger, and their feeling of self-worth starts getting really impacted at that point. Oftentimes, just like my co-panelists talked about, there's a co-occurring conditions, right? So then that requires the parent and the professional to kind of know what is impacting the student at that time. And maybe it's both of those disorders are impacting them at that time, but maybe it's not. So maybe you need to be able to figure out which strategy do you need to use now to get them through this hump that they've got going on right now. We do tend to see some rates of greater depression and anxiety in some of these children, which plays a part into how they perceive themselves. So sometimes we're also looking at motivation. So when we look at some of the levels of dopamine in there, you've got that pleasure chemical that's at play. If they have a low dosage of that, then they don't have a lot of motivation. And if learning is hard and you don't have a lot of motivation to do it because learning is hard, you've got this cycle that keeps going and going and going. So you can see how all of these factors could play a role in their mental health.
Thank you for that. Dr. Hadley, from an early age, can you tell us a little bit about some of the common challenges that children with learning differences encounter?
Being viewed as learning differently and even showing some of those behaviors outside of the norm may possibly, depending on the age of the student, have them view themselves as differently, and starting to do this comparing and contrasting kind of thing that's normal to do. And what could then be an issue is they are, again, showing signs of depression, possibly acting out, and other kind of deviant behavior. This notion of trying to be themselves, but yet and still trying to fit in.
All right, well, thank you. Well, Dr. BODUCH, are children with learning disabilities more vulnerable to criticism, or is it that they receive more criticism because of their failures in schools, because of their learning differences?
That's a great question, and I really did spend some time thinking about that, because I think initially that's true, right? When you have a new school year and you've got a new teacher, you're getting to know each other, so that relationship and that trust hasn't been built yet. But as students start feeling more safe, they're willing to take more academic risks and social risks, so then you'll see that their growth will start coming, right? It's so easy to focus on the negative, right? Everybody notices what's going wrong, but sometimes it takes a special person or a different perspective to see the positive that's going on. And our students have unique needs and they have unique behaviors. And that relationship that the educator is going to build with them will help them figure out what strategies, what interventions could they be used to help them be successful. One of the things I think we also need to be aware of is that they have challenges and strengths at the same time. So being able to pay attention to what's going on with their strengths and challenges and build off of that. I mean, and we also need to be honest too, right? That data drives a lot of our schools. Data drives the IEP, data drives funding, data drives just about everything. So we can't ignore that factor. So then therefore we are paying attention to some of the struggles that they have a little bit more, because we need those numbers. We want to track the progress. And speaking of progress, we need to remember that their rate of progress may be a little slower, but they are making a rate of progress, and we need to celebrate the positive things that they're doing, reinforce those behaviors that we really want to see them use more often.
Thank you for that. That's certainly very important to keep in mind. Now, Dr. Hadley, also very important to keep in mind is that parents and teachers need to be the eyes and ears for these students. Can you talk to us a little about some of the red flags that parents and educators ought to be on the lookout for that may signal that mental health challenges are lying in wait?
Yeah, one of the biggies is high levels of frustration. The student's inability to control their anger, maybe self-regulate and show appropriate behavior depending on the environment they're in. Poor social skills, not fitting in with their peers, and maybe acting out some of the times when they are with their peers, again, because of that frustration level. And poor boundaries, just not, knowing when and where to do certain kinds of things. And that's what parents really can help them to work on, if you will.
Thank you for that. Dr. Schiff, if parents and educators do start noticing these signs, what do you advise them to do?
So firstly, before the actionable advice, I think psychologically, especially for parents, it's very important that they kind of examine their own feelings. So learning disorders in children can be genetic. So sometimes I've seen, parents see their child struggling and it brings back difficult memories for the parents themselves when they were children and they were struggling in school, or it makes the parents kind of feel guilty, like it's somehow their fault. And kids are very sensitive to their parents' emotions and will model their own feelings off of that. So the best way to help your child feel more positive is if you start feeling more positive as well. But once you do start noticing these signs, I would say to parents, consider talking to your child's pediatrician about your concerns, or perhaps a support services staff at your child's school, because these are people that can help refer you to a licensed mental health professional for further therapeutic interventions and assessment.
All right. Well, as a follow-up, how are mental health issues treated with children with learning disabilities? Are there unique treatments or protocols for them?
Yeah, absolutely. So with this patient population, I think it's really important to take an individualized approach because one size does not fit all here. So for example, talk therapy might be less effective for someone who has a learning disability that affects their communication skills. Or maybe keeping a journal as part of treatment might not be helpful for someone who's dysgraphic and has writing disabilities. So CBT, which is cognitive behavioral therapy, is a type of therapy that aims to, identify and correct unhealthy and unrealistic thought patterns that we have. And then the goal is to help help people modify their behaviors, thoughts, and feelings and change them to be more realistic and helpful. So if you restructure their thought patterns, you're starting to create a more, positive sense of self, which enables them to become more confident and then cope better with life in general and not get as frustrated as easily and regulate their emotions a little bit better. The great thing that I like about CBT is that it's very flexible, and therefore it can be adapted based on, the child's clinical presentation. So you can pace the content and the speed of therapy. So maybe treatment might take a little bit longer or require more sessions. For example, in adaptation, you could use homework assignments where you give the patient a worksheet to take home and complete before the next session instead of completing it in session with you. Or if a child finds it really hard to describe something, verbally in words, they could draw it out instead. I think, parent guidance and skills training is also really important when it comes to these patients, because these techniques are aiming to help parents kind of better understand their child's needs and how to best support them. And family therapy can help with reducing the strain on relationships and caregivers. Also, creative arts therapies, so things like music, dance, or art, can help these kids find new ways of expressing themselves. And just overall, learning disorders are very resistant to medication. They're typically a lifelong challenge for, the individuals who face them. So medication management is typically not part of treatment for learning disorders.
All right, well, thank you. Well, Dr. Hadley, what are some other factors that parents should keep in mind when they are trying to find a therapist for their neurodivergent child?
The premise of good therapy really is trust, and the therapist and the client, student, patient really does feel some level of a connection to that therapist. So I would think for younger kids, maybe even the parent going to a few sessions early on with the student to kind of show some level of connection with the therapist too, and giving the student some level of comfort. And then kind of segueing out and letting the student attend on their own. And the other piece of it is if the student's already diagnosed with this disability, then the testing might not be such an issue. But if the parent is in this kind of wanting to know stage, if they see things aren't right and really want to get at the root of all of that, then maybe additional testing would be something they could do. And they should keep in mind that they should get that testing done with a psychologist or psychiatrist, because they are able to give this battery of tests and even medication if it's needed.
All right. Dr. BODUCH, can you provide us some tips and strategies for parents to use to try to fortify and bolster their kids so that they can bear up to the stresses of life and challenges and bullying that may come with being a neurodivergent child?
Absolutely. So communication is very important. That's going to be key, as is that relationship you have with your student. Maintain it. You want to be that person that they can always come to, no matter how small, how serious, everything. You don't want them not to have somebody to turn to. So you want to make sure you maintain that and be honest with them. Have the honest conversation about the challenges that they may be coming up upon. Empower them to become the self-advocate that you're going to need them to be. They're going to have to grow up and be able to speak for themselves. Start that early. When you're looking at behaviors, are you looking at only the negative side, or are we able to see that positive side? If there's a teachable moment there, take the time and do it. Do the teaching that needs to be happening at that moment. Very, very important. Typically, you can always find some type of positive side. It just means that we need to kind of reframe our thinking and the conversation that we're having. While we are here over at the center, we always use the mantra, catch them being good. So reinforce the behaviors that you want to see more of, right? And also acknowledge them that they're working hard, that you notice this. I like to use the I notice statements. I noticed you took your homework checklist out before you got started. I noticed that you were realizing that you were talking too loudly and that you lowered your volume. Use the I notice statement. They're quick. I used to call them drive-bys when I was in the classroom. I'd give them a quick I notice statement and drive right by. Just keep going. They don't require you to have a lot of explanation going on as well. Take the time and do the explicit teaching, right? I talked about that teachable moment. They're not just going to get it. Things that just typical students will be able to just figure out on their own, they're not going to be able to do that. We need to be able to have that conversation, break down those behaviors into manageable steps. Social interactions are going to be really hard. We have to pre-teach, we have to model, we have to practice the behaviors that we want. Use social stories, have them practice in a safe environment. Pictures are worth 1,000 words, right? They say that. Visuals you can use your photographs, you can use movies, you can make movies, right? Have them involved in that. Collaboration between the services, make sure we're all on the same page. We have the same expectations, we are using the same language, because repetition from all the different facets is going to be super important. Another strategy you could use is mindfulness. Can they focus on the present moment that they're in while maintaining a calmness and accepting their feelings and their situation and their thoughts that they're at? Music, we had already talked about the arts. We've got the music, we've got arts involved. Talents, what are they good at? Sometimes we need to step back and think outside that box and say, wow, how can we use this talent and expand on it? Peer mentors, right? What's the best way for them to learn is using their peer mentors. They can help with their social skills, their academics, their communication skills. Get them involved in the extracurriculars. Have them form a circle of friends, because that will be important. And then finally, building resiliency. Do they know how to exercise self-care? Do they know how to use affirmation statements? They can put a little sticky note on their mirror every day about something that they want. I'm good at being friends. I'm good at following the line leader, whichever it is that they are. Have an affirmation statement. Are they getting enough sleep? Are they eating the healthy food that they need to fuel their bodies? Are they getting good exercise? And that also encompasses the family, making sure the families are all following that as well.
All right, well, thank you. So, Dr. Schiff, I'm wondering about early intervention. When it comes right down to it, is the best preemptive for warding off mental health challenges in neurodivergent children early identification and early intervention into their specific learning disability?
Yeah, absolutely. So early identification and intervention can definitely lessen the effects of learning disorders. And so if a parent suspects something might be different or kind of off, I always encourage them to approach their child, school, or teachers to request an evaluation. Parents are their child's best advocate. And sometimes children don't get diagnosed because if they're academically underperforming, it may actually be dismissed as being due to a lack of motivation or maybe insufficient studying, or they're just not trying hard enough. But there are also children who have actually learned to adapt, overcome, and sometimes even overcompensate for their learning disorder. So they're actually not on anyone's radar at school as having learning challenges. Learning disorders can also vary in severity. So if the child doesn't demonstrate enough of a performance gap between, themselves and their peers, it may go unidentified. So I think parents should definitely pursue the appropriate actions through school, which would include, an evaluation, getting tested in order to identify learning disorders, early on. When a child gets evaluated or they're given, a full battery of assessments, we usually see a discrepancy between, the child's IQ and their achievement score. So it shows that based on their IQ, they should be able to kind of achieve at a certain level, but their actual achievement is kind of falling short of that potential. And then further subtests can actually specify what areas of learning they struggle with, but also actually highlight their strengths, which can then help school better accommodate them and their learning style. So early identification intervention, most effective methods of ensuring learning success for children, because learning disorders actually don't go away, and they actually grow more problematic as more time passes and as children age and get older. So early diagnosis improves the child's ability to reach their academic potential and actually helps prevent the development of low self-esteem and other, associated behavioral problems.
All right. Dr. BODUCH, let's jump ahead a bit. Come college time, neurodivergent students are finding that they've got new roles, new responsibilities, and new stresses as they become the big man or big woman on campus. And I imagine that this brings new mental health challenges. Can you talk a little bit about that?
Absolutely. When you think about it, right, it's hard to be a young adult in general. And if you think back when we were young adults, it was hard then. Now, if we compound that with having a learning difference, it can be very, very overwhelming, right? So that plays a factor into it. Oftentimes, these students are immature. They haven't had many of the experiences that our other students have had. They haven't had the social experiences with their peers. They're multiple years behind. So then this all plays a factor in it as well. They don't know how to navigate these situations. And sometimes if they're doing, as they are navigating it back home, right, they had parents and a support system and a teacher that was able to kind of intervene and run a little bit of interference for them. And now they've got to do it all on their own, right? They don't have that option. The new environment is playing a huge role in their college life. For example, if it's cold outside, right, mom or dad may have cued them to put on, wear jeans and put on a coat or a hat and gloves or something like that. sometimes we'll find that our students are out here and it's freezing outside and they've got shorts and sandals on because nobody was there to cue them. They didn't learn that. And the weather directly impacted the student. So we need to create some of those supports available to them so that they're able to do that. This will also impact, again, I talked about social situations. They don't know really how to make friends on their own or how to keep friends on their own. They don't understand that dynamic. And then let alone throw in the romantic relationships that are always occurring. That's a whole new segment on its own. And then we have also academic stress hinders their physical and mental health. So sometimes they're going to require support systems to be able to manage the stress that they've got going on, but they also need to be willing to accept those services. Sometimes we find that students aren't really willing to do that. So having the conversation with mom and dad that encourage them to use the supports that are available to them because they're used to going through their high school career and they just magically appeared. They were there for them. So we need to help them get the voice that they need to be able to use forever to be a self-advocate for themselves.
All right. Well, Dr. Hadley, what are some factors that help neurodivergent collegians persist to graduation, and how can parents help them build those muscles now before they even set foot on campus?
In my previous life, before becoming a faculty member, I was a practitioner at a couple of other universities, and I'm a licensed counselor. And we find, and I've done tons of research around college students with disabilities and about their persistence. And we find that students with disabilities in general are much more vulnerable when they transition from K through 12 to higher ed, and then when they transfer out of higher ed into graduate college or the work environment. The biggest piece of it, as Dr. Schiff mentioned earlier, is the disability doesn't go away. Students sometimes think they outgrow it, that it goes away. They no longer have this disability. And when they're in the K through 12 system, their academic progress is overseen by the Individuals with Disabilities Education Improvement Act. That legislation requires the schools to identify the students, provide them all this oversight through IEPs and support. Well, when they move to higher ed, they transfer out of that IDEI category and to Section 504 and ADA. And those legislations don't require universities and colleges to do as much or as many accommodations as services they get in K through 12. So I always advise families and students and college admissions counselors and K through 12 high school counselors to prepare students better to come to college, to have them do some kind of transition planning, coming to college, looking at college, sitting in some college classes, trying to find a college or a university that best fits their needs. It's just not a random decision. And doing a little bit more soul searching about what they want to do as a career too, and understanding how classes and vocations and careers all connect together. And the first thing they need to know to do that sometimes students don't do is to identify themselves when they come to campus. The university cannot reach out and do anything for them if they don't identify themselves. So most universities have an office for students with disabilities, and they go to that office, provide their documentation, which should be no older than 3 years. So they should probably get retested in their junior year in high school before applying to colleges, and bring that testing to the university, because most universities don't have the resources to do the testing that would identify the student with a disability or upgrade their testing. So doing that testing and making sure once they're on campus, going to that office and identifying themselves. They don't have to identify themselves in the application process, but once they've been accepted by a university and they are heading to campus, get to campus and meet with the coordinator of disability services or director and find out, because that will be your gatekeeper, their gatekeeper for their entrance and a big part of their success on campus, and finding out the things they need to do, because they'll then have to advocate with their professors about services, about accommodations for their class. And sometimes students stay in hiding because it's overwhelming too long and fall too far behind. So if they can do that early on, they really do themselves a favor.
All right, well, this is the lightning round, and I'll ask each of you to give us one bit of closing advice for parents, and I'll start with Dr. BODUCH.
My advice will be to have an open line of communication and maintain that relationship no matter how hard it is.
Dr. Hadley?
Be mindful and thoughtful about school choice. Just making sure there's a good match between the student's interests and the university they want to attend. Most community colleges and four-year public institutions have more resources in place than private institutions, just because of budgetary issues. So be more mindful about that decision.
And Dr. Schiff, you have the final word.
Yeah, so I guess I would say, not to get frustrated. And I know it sounds cliche, but don't give up. I know sometimes it does get worse before it gets better. And this is, it's a constant struggle. It's an uphill battle. There are a lot of frustrations along the way, but to kind of just, keep forging ahead and, moving forward. And I promise you, it does get better, even when there are some days that are a little bit difficult, or some weeks or some months, especially with school, where you just have a lot of struggles and your child is definitely struggling. But to not get discouraged and to just keep going.
All right. That'll have to be the period on our conversation today. Dr. Melissa BODUCH, Dr. Wanda Hadley, and Dr. Holly Schiff, thank you for the knowledge.